Covered California writes to Dr. Oz. Hello, I am Kevin Knaus, an independent health insurance agent in California, and also a certified Covered California agent. And Covered California has written a letter to Dr. Oz, who is now the administrator for the Center for Medicare and Medicaid Services, CMS. And CMS oversees the Affordable Care Act, eligibility and enrollment. They propose rules. And CMS came out with a new rule back in March. They proposed it. And there's a lot of things in there that would change some of the stuff that Covered California does to help people enroll into health insurance. And I did a video on the proposed rule changes. Now, these rules, proposed rules, came out in March. Dr. Oz has been installed as the administrator for CMS in April. So Covered California wrote an 11-page letter to Dr. Oz, and it is signed by the executive director of Covered California, Jessica Altman. And it is a very polite letter, and it has a very good defense of the success of Covered California and how we have been operating and how many of the proposed rule changes are unnecessary. And what I'll do is just kind of pull out some of the salient remarks within the letter addressing certain issues. And one of the first one that they have on the first page is talking about how states are unique. It says, with a one-size-fits-all solution to a problem that does not exist in California, we are concerned that the proposed changes would make it more difficult for eligible consumers to enroll in and pay for needed care while unnecessarily undermining the efficiency and stability of our marketplace operations. And again, I want to point out that Covered California is not funded by taxpayer dollars. They are a standalone agency that generates their funding for their operational budget from fees assessed on the insurance plans. And they go on to state that requiring state-based marketplaces to follow the same policies as the federal marketplace without robust explanation as to why such uniformity is necessary or beneficial. And so they're pointing out, hey, we're all different, and you need to give us latitude to create different mechanisms to help people enroll. Now, one of the proposed changes was this kind of active renewal that if people didn't go into their accounts during the open enrollment and verify income or just kind of look at stuff, they would be assessed a $5 monthly premium if their health plan was zero cost, and they would have to pay that or then go back into their account and make sure everything looked good. And if they didn't pay the $5 premium, they would be terminated. And it's just kind of an odd situation. And Covered California writes, imposing a more cumbersome re-enrollment process exclusively on marketplace consumers is both unjustified and illogical. Ironically, implementing a $5 charge that may later be eliminated is more likely to lead to consumer confusion and ultimately loss of coverage. Again, we urge CMS to continue to allow states the ability to continue policies that have proven effective for the marketplaces. And when they reference that it is more cumbersome than other enrollment processes, they're referring to Medicare, small employer group plans, where your enrollment just rolls over. You don't need to go in and sure, you should update your address, but they're saying that this is, why are you making this difficult for marketplace consumers, individuals and families? CMS wants to do away with the ability of exchanges like Covered California to upgrade consumers from a bronze plan to a silver plan because they say that is against consumer choice and it uses too much premium tax dollar. Covered California responded, the 2024 Covered California member survey reflects strong approval for the affordability crosswalk initiative, moving people from one plan to another in their benefit, with 90% of members who were notified about the plan change finding the crosswalk useful. This indicates broad endorsement of the policy and, crucially, has not led to consumer confusion or grievances. And I do want to note that Covered California also implemented a crosswalk for people that had a gold and a platinum plan where they could pay less and get better benefits if they selected a Silver 87 or Silver 94 plan. And so Covered California worked with about 20,000 consumers to save money. So completely doing away with this crosswalk would just hurt consumers in the long run. CMS wants to do away with DACA, Deferred Action Childhood Arrivals in the United States, from being able to enter into the marketplace exchanges and receive premium assistance because they technically are undocumented. And the response from Covered California reads more like a mission statement. Covered California is deeply committed to ensuring that all individuals and communities have access to comprehensive, equitable health care, reflecting our state's core values of equity and accessibility. By embracing the diversity of our state and recognizing health care as a fundamental right, we work towards a healthier California, including DACA recipients and marketplace coverage, reduces uninsured rates, brings younger enrollees into the market, and connects Californians to coverage they need and deserve. We strongly oppose removing DACA recipients from the definition of lawfully present. So Covered California is staking out, this is who we are. This is what California does. And to rip health insurance away from people, that's not how we operate in California. Another change to the rules proposed by CMS was stricter, tighter restrictions on special enrollment periods. That's when people in the middle of the year, outside of open enrollment, have a qualifying life event, loss of coverage, divorce, a child, young adult moving from the parents' plan because they've turned 26, and they have a special enrollment period. And CMS wants to tighten up. They want more documentation on the verification because they think people are gaming the system. They think people are just coming in and getting health insurance without going through the proper channels. Covered California responds, the proposed requirement that consumers identify and submit documentation proving that they have experienced a qualifying life event would impose an unnecessary and substantial burden on consumers genuinely in need of coverage during major personal life changes. They add, moreover, the demographic profile of SEP enrollees, particularly since 2019, skews younger than those enrolling during the open enrollment period, contributing to a healthier risk pool. And what they are mentioning there is that, yes, we want young, healthy people in the health insurance pool to stabilize the rates. With respect to documentation, sometimes, especially if someone's getting a divorce, they don't have a piece of paper in their hand at that time that says they're going to be losing coverage. Now, Covered California does randomly audit special enrollment periods, and as an agent, I always recommend that people make sure that they have documentation of that qualifying life event. CMS wants to prohibit sex trait modification services, as they call it. We also know it as gender affirming care, healthcare services for transgender individuals, and they should be covered in a health plan as an essential health benefit. And Covered California mentions, rather than implementing a blanket prohibition on coverage of sex trait modification as an essential health benefit, CMS should honor state flexibility in defining essential health benefits, ensuring packages are comprehensive, evidence-based, and match employer coverage standards in line with the ACA's purpose. Because the ACA, one of the fundamental underpinnings is that it would reflect broadly employer group coverage. And Covered California goes on to state, in California, long-standing non-discrimination requirements prohibit coverage exclusions based solely on the enrollee's sex, including gender identity. Such requirements apply to all state-regulated employer-sponsored coverage in California. So they're calling out the problem with the rule, basing it on employer coverage, stating that employer coverage doesn't include gender-affirming care and the essential health benefits, because in California, it does. Shorter open enrollment periods. CMS wants to limit open enrollment from like November 1 to December 15th, but it's just a major cluster. It's just stupid. Covered California goes from November 1 to January 31. And again, CMS argues that there's people that jump into the exchange in January just to have a health condition fixed, and then they get out. But Covered California is refuting that. Covered California's traditional open enrollment period has proven effective and straightforward for our consumers, allowing them sufficient time to choose a plan that is right for them. Further, it has worked for our market, supporting both additional and healthier individuals to enroll, and has helped enhance the stability of our marketplace. Now, I underlined work for our market. Covered California is a marketing organization. For any enterprise to be successful, you must know your market. You must know your consumers. And that's what CMS doesn't do. They don't know who is enrolling. They see some data and some statistics, but most of the people who designed the Affordable Care Act and work at CMS, they're not enrolled. They haven't gone through the process of the Affordable Care Act and Covered California or some of the healthcare.gov. And Covered California, since 2014, they've got experience with how this works, the problems. Yeah, sure, there are still some issues that we run into, but they have addressed many different things over the years. And Covered California has developed a platform application and whatnot that really helps people get into subsidized health insurance and keeps them covered. And the takeaway from the letter is, Dr. Oz, we've got it dialed in. There's no fraud, waste, or abuse here for the most part, and if there is, we catch it and we deal with it. So just let us continue on without any unnecessary, burdensome, consumer confusing rules in the future. Whether Dr. Oz will take the experience and learned advice of Covered California, the executive director, Jessica Altman, remains to be seen. But if you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, have a great day.